Hi, I'm Kailing and you're watching Razor Top 5 and we are bringing you a special report on swine flu. The Health Ministry said in a press conference this afternoon that Singapore has no cases of swine flu at the moment. As of today, 17 people have been sent for testing. Of these, 3 are undergoing further tests to see if they have the common flu or an unknown strain. Health Minister Wong warns that it is only a matter of time before swine flu hits our shores. But Deputy Prime Minister Wong Seng assured Singaporeans that the nation is prepared for any outbreak.
We are better prepared today than when we were in February, March, April 2003. So having been through that myself and having chaired the committee too, I know that at least we have done something more than what we used to know. So let me emphasize again, everyone must take precaution, and only then can we hopefully minimize the transmission of the virus among the community. But with any human flu pandemic, there are many unknowns. We cannot anticipate all kinds of situations. But we have to find ways of dealing with them when we are confronted by them and try to anticipate as much as we can.
Now, the authorities have been on high alert since news of swine flu broke out. But how are Singaporeans reacting to the news? Razor TV finds out that more people are flocking to their family doctors to be vaccinated.
These shelves are meant to be filled with supplies of the antiviral drug Tamiflu, but now they've been left empty. With fears of a swine flu outbreak here, Singaporeans are not taking any chances, as many are flocking to private clinics to get flu vaccinations. And the demands for the vaccinations has caused shortages. In some clinics, such as this one here, stocks are running empty. However, not everyone believes the vaccines are necessary.
Don't see the need to, lor.
Not necessary. So far, nothing from the government, man. You didn't announce anything.
Tell me, is there really an effective vaccine at present against this type of flu?
Well, if you're considering getting vaccinated, here's something you should know. Something to be noted here is that flu vaccinations and swine flu vaccinations are 2 completely separate things. Members of the public need to be notified of the difference.
Vaccines may be running low at private clinics, but the government has a stockpile of over 1 million doses of antiviral drugs, and this is enough to treat patients with H1N1 should the need arise. Health Minister Wong said we have enough to treat 25% of the population. Mr. Kaur said both Tamiflu and Relenza appear to be effective in treating swine flu if early treatment is sought. But he advised against stockpiling or taking them if one is healthy, as they would not prevent them from contracting swine flu.
But at this point in time, there's no vaccine. But for people already infected, then prompt treatment by Tamiflu appears to be effective, or Tamiflu or Relenza, so there are alternatives here, appears to be effective. So that is the purpose of Tamiflu. So please don't go out to buy Tamiflu or ask doctors to vaccinate you with Tamiflu. In fact, there has been studies, even last year, because of people who vaccinate themselves with Tamiflu, I suppose out of ignorance. And doctors are discovering that it creates resistant problem because, so that time the concern was H5N1. And there have been studies whereby they found that people who vaccinate, inverted commas, themselves with Tamiflu and find that Tamiflu doesn't seem to protect them if they are exposed to H5N1.
Public hospitals have started restricting visits to patients. Most say that they are limiting the number of visitors to 1 or 2 per patient for now. At Singapore General Hospital, they are barring children under 12 from visiting its ward patients. Razor TV was at Tan Tock Seng Hospital where many possible swine flu cases are brought to.
This separate wing of Tan Tock Seng Hospital is part of the war against swine flu cases. Cases from the airport and patients who have travelled to affected countries are scanned here. And when Razor TV visited the place on Wednesday evening, we witnessed one patient being whisked off to the Communicable Disease Centre for testing. Patient 18 or more. But the testing procedure is part of the battle against swine flu here in Singapore.
I think we did well last time, but there was an old war. This is a new war now, and we have to adapt our approach to face this new enemy. And in many ways, this new enemy is much more difficult than SARS. I would stress 3 points on why it is different and more challenging to deal with. I think first, this swine flu is a lot more contagious. You look at how fast it has spread around the world to several countries now, and the speed of spread. And secondly, as you heard from the earlier technical briefing, that unlike SARS, patients can be infectious even before symptoms appear. So what this means is that border control cannot be foolproof. And I think third complication of the flu pandemic is that historically it tends to come in waves. So remember SARS, we had a big fright and we won the battle and it just quietly faded away. Whereas flu pandemic unfortunately has a habit of coming in waves, and sometimes the initial waves may look mild, so your guts are down, and then the second wave can then be quite lethal. So this third difference means that dealing with this swine flu pandemic is likely to be long drawn.
Alert yellow level precautions are in place at Tan Tock Seng Hospital to prepare for whatever wave of cases that might come, and that means temperature checks and surgical masks for visitors. The latest precaution, thermal scanners, which started operating at 8 p.m. on Wednesday night. This will help the busy hospital keep tabs on about 10,000 people which head to its wards and medical centres every day. So if you have an appointment at the hospital, better head there at least half an hour earlier, especially on Mondays, Wednesdays and Fridays when the facility is a lot more crowded.
Schools across Singapore conducted temperature checks on students this morning to make sure they are ready in case of an outbreak. At Southview Primary School in Choa Chu Kang, a full exercise was carried out with screening stations set up near the school's entrance. Students who failed the first screening test are isolated and sent to temperature-taking stations to see if they are really unwell. Teachers also explain to students the importance of good hygiene. And those are our top stories today. If you have a news tip, photographs or videos that you would like to share with us, do email them to razortv@sph.com.sg or MMS us at 75557. Also, if you have something to say about our programs or anything at all, log on to Razor TV forums and type away. And join us tomorrow from 2 p.m. for more Razor Top 5. But don't go away just yet, as we have the full press conference on swine flu up next.